Welcome to Module 2, the Health Rationale and Definitions for Safely Managed Sanitation. The SDG framework defines the global indicators and targets for SMS, and this module will present the SDG 6.2 definitions for sanitation that are used for global monitoring. Global evidence-based guidelines complement SDG definitions and assist governments and partners to operationalize the SDG target for sanitation using best available knowledge on what works. This module will also cover the core recommendations of the sanitation and health guidelines issued by the WHO and also the normative definitions for safe sanitation relevant for program design and delivery at each step of the service chain. By the end of this module, you will be able to describe why safely managed sanitation is needed to improve health and why the global targets in the Sustainable Development Goal era have changed from the Millennium Development Goal era. Understand the four main health protective recommendations of the WHO guidelines on sanitation and health. Outline ways to move up the so-called JMP ladder, including service level definitions, and be able to analyze pathways to SMS within their context. Define SMS at the different stages of the sanitation chain, including an understanding of how to find and use program definitions for SMS at the toilet, containment, conveyance, treatment, and disposal or use stages of the sanitation chain. Form a technical grounding for Module 3, which will discuss how to use definitions in country standards, regulations, and plans as found in Chapter 4 of the Guidelines on Sanitation and Health. It is well known that poor sanitation is hazardous to human health, either directly as a consequence of infection, although impacts on well-being. Let's not forget that well-being is also part of the WHO definition of health. Firstly, feces contain a cocktail of pathogens causing dysenteries and diarrheas such as cholera, which predictably recurs in areas with poor sanitation. Poor sanitation also transmits intestinal worm infections as well as typhoid, which is becoming increasingly resistant to antibiotic treatments. Poor sanitation even transmits polio, which is on the brink of global eradication. Contributes to the spread of vector-borne disease such as trachoma and lymphatic filariasis, whose vectors prefer to breed in feces and wastewater. Secondly, repeated infections caused by poor sanitation can lead to health challenges such as stunting, impaired cognition, and anemia, exacerbating the consequences of stunting. Finally, lack of safe sanitation facilities in all spheres of life, a home, school, in public places, and health facilities, also leads a range of challenges to social and economic well-being, such as loss of opportunities for play, education and work, and also anxiety and risk of assault caused by not having safe place to defecate. Sanitation is also a human right and a public good, delivering ultimately cost-effective benefits for public health, the economy, and the environment. The human right to sanitation states that everyone is entitled to a private, dignified, safe, accessible, and affordable toilet in all spheres of life, and importantly also, the right to not be exposed to the unmanaged excreta of others. The economic concept of a public good is a service that benefits all of society. While the government is ultimately responsible, it can be provided by the government, private organizations, or individuals. For such goods, users should not be denied access due to inability to pay, a situation for which smart, targeted subsidies can help. And one person's service should not prevent or reduce access and service quality for others. Let's talk a bit more about health. Comprehensive evidence reviews conducted for the guidelines on sanitation and health show the way sanitation is implemented is not improving health as we might expect. Many sanitation interventions have been found to have little, and in some cases, no impact on health. The reasons are myriad, but at its core, these interventions are failing to identify and interrupt the pathways of disease transmission at community-wide scale. Calls for transformative WASH seek to define and design comprehensive programs that reduce risks at all steps of the chain and thus achieve health impact. Toilets are only the first step in delivering safe sanitation. Later in this course, we will introduce you to the concept of fecal sludge management, or FSM, as it is known, and wastewater treatment. However, for now, we'll look at the critically important sanitation service chain, which also illustrates that failures at any step of the sanitation chain can result in negative health outcomes. Because most of this chain is outside of the direct control of a householder, it is critical that actors, including local and national government and the private sector, do their part to ensure that risks are managed along the whole sanitation service chain, from toilets, containment, to transport, treatment, and finally safe use or disposal of wastewater and fecal byproducts. As the world becomes more urbanized, this chain is more important than ever. This is an updated version of the fecal diagram, also known as the F diagram. It helpfully shows fecal oral disease transmission routes. An important new aspect of this F diagram is that it shows how failure at any point along the sanitation chain can lead to disease transmission. Feces, which are not disposed or stored safely, represent a health risk for humans, since pathogens in feces can be transmitted through many different routes to humans: flies, contaminated foods, and washed hands, through crops and fluids, including water. The F diagram depicts those relationships in a simple manner so that everyone can understand them. Next, we will talk about minimizing the hazards at each step of the chain. Now we are looking at the excreta flow diagram, also known as a SFD, which means shit flow diagram. This diagram helps us understand the various hazardous events by illustrating where in the chain failure can occur and humans can be exposed to fecal pathogens, from toilets to containment to conveyance to treatment and to end use or disposal. Hazardous events caused by unsafe excreta management can lead to exposure for humans. Let's look at some typical risks along the sanitation service chain. We start with unsafe, unclean, unpleasant toilets that lack privacy, can bring people into more contact with excreta and be a point of disease transmission. Or people may avoid using them and revert to open defecation. In this illustration, excreta on the floor, lack of hand washing facilities, places where flies and insects can easily enter, and a poor superstructure increase hazards. As well, it may not be accessible to all intended users, and it does not appear to have anal cleansing material. Pits and septic tanks are susceptible to containment risks, such as cracks and leaks in the structure, spillage of fecal sludge during emptying, liquid effluent discharging to open ground, or washouts caused by flooding. All of this can expose humans to pathogens via contamination of drinking water, nearby food crops, and communal areas. A sanitary inspection would reveal risks in the system that need to be remediated to make the system safe. We will discuss sanitary inspections later in the course. Some containment options, for example, pit latrines in low-density areas, never need to be emptied. Instead, the pit is abandoned, covered, and a new pit is dug. Similarly, twin pits can be safely emptied and used locally after sludge is stored for an extended period of time. However, most containments, such as septic tanks, seen here, and single pits in dense areas will eventually need to be emptied and content transported away for treatment. Fecal sludge must be emptied and transported in a way that protects service providers, households, communities, and the environment. spills, unsafe handling and lack of protective equipment, and especially dumping of emptied sludge in waterways and on farms instead of delivering it to treatment can all expose workers and the community to pathogens. Also, emptying poses potentially fatal risks to workers, such as being buried by walls, collapsing in unlined latrine pits, breathing in toxic gases, and injury from garbage disposed down toilets. This is true for on-site sanitation systems, but also a major risk for workers entering pipe sewers for inspection and unblocking, who frequently face risks of asphyxiation from inhalation of toxic gases. Typical risks associated with wastewater and fecal sludge treatment plants include overflow in time of high rainfall, failures of treatment processes for a wide range of reasons, and unsafe disposal post-treatment where wastewater and sludge is insufficiently treated for its next purpose. Particular high exposure environments like drinking water catchments, food crop production, or swimming areas, as we see in some of these images. So based on all this, how do our approaches need to change to get better health outcomes from sanitation investments? Here, we will summarize the 4 main recommendations of the WHO Guidelines on Sanitation and Health. Recommendation 1 in the Guidelines on Sanitation and Health says, everyone, everywhere, needs to have and use decent toilets. So, to achieve this recommendation and improve health, well-being, and human rights for all, we need to change some of our approaches to ensure the following. Toilet use by everyone in the community. Without it, we have low or partial coverage, which means everyone is exposed to the excreta of those without toilets. No one is properly safe until everyone is. As well, the rights, dignity, and well-being are improved for who have toilets. Provision of at least basic toilets and containment measures of a minimum standard so that pits or septic tanks don't pollute the groundwater or local environment. Working on both demand for toilets and supply at the same time. So, when demand is created through behavior change approaches like community-led total sanitation, we need to meet that demand by supplying safe, affordable, and desirable toilet options and toilet components such as slabs and septic tanks. We think about all the places or settings where people need to use a toilet as they go about daily life, at home, at school, in health facilities, at work, and in public places. While individual sanitation is a goal, in some locations, shared or public toilets may be the only interim option to make sure everyone has a safe place to go, even while aiming for progressive improvement that eventually results in individual toilets for all. Recommendation 2 of the guidelines covers the safe sanitation chain. This is where the major gains in health impact are achieved, especially in urban areas. Sanitation services within that chain are also critically important. By focusing on more than just toilets and safe behaviors, we can develop a functioning service chain that is well managed by service providers and accountable to institutions and the people they protect. What does this mean? Well, we should first consider what happens after the toilet is used, who is responsible and what services for safely managed sanitation exist, since most of the rest of the chain is outside the control of households. We need to think about things like, does a containment provide treatment on site? Will it need to be emptied? Is there a hatch so emptiers can access it? What kind of emptying services exist? Where will they take it? To a treatment plant or a neighboring farmer's field? Does a treatment plant even exist? Who runs these services and how much do they cost? Remain technology agnostic. Think about what works in the local context, as there are many technologies with strengths and weaknesses depending on the context of the environment and society. Try to avoid picking a silver bullet technology or service type and keep an open mind about technology solutions so long as they meet minimum performance standards for safety. For this, you can review Chapter 3 in the Guidelines on Sanitation and Health. Work on the biggest risks first. Chances are there will be a lot to do, so it's important to identify the highest risk affecting the most people and to work on those first. In rural areas where treatment can happen entirely on site, you may be able to achieve SMS in one step. Remember to include the workers. Safely managed means people doing that management and operations work safely. We should always remember sanitation workers, especially informal ones, can suffer horrific working conditions. SMS means we will need more workers and they will need safe, dignified employment. Recommendation 3 in the guidelines covers sanitation service delivery alongside other local services. Historically, sanitation has struggled for visibility, expertise, and investment when lumped together with drinking water and other wash services. Sanitation needs to have a higher profile, capacity, and investment as a specialized sector in its own right. However, it also needs to be delivered in coordination with other local services to be efficient and sustainable. For example, planning of a sanitation system is much easier and of higher quality when it is coordinated with the urban planning compared to retroactively fitting sanitation into urban areas designed without sanitation in mind. Further installation can be more cost-effective when combined with roading upgrades, for example, and functionality improved when needs for water supply and drainage are coordinated with the sanitation solution. Recommendation 4 in the guidelines spells out the role of the health sector in ensuring sanitation to protect health. Many aspects of sanitation, service delivery, and oversight are delivered through national and local authorities outside the health sector. And rightly so, the health sector is not well placed, for example, to build infrastructure, to manage fecal sludge management services, or regulate tariffs. But there are 6 critical functions the health sector must fulfill to ensure sanitation protects health and reduces the burden on the health system. These are: contribute to sector coordination. They may not necessarily lead, but contribution is needed to ensure policy and plans support national health objectives. Similarly, the health sector should contribute to developing sanitation-related norms and standards, such as standard designs and performance criteria for treatment devices to ensure performance under the intended use will break disease transmission. Specifically, the health sector should lead on making sure sanitation is included, health policy and program where sanitation is needed for primary prevention, such as cholera, typhoid, soil-transmitted helminths, antimicrobial resistance, and more. Making sure sanitation status is included in health surveillance systems. This helps target sanitation investments in high prevalence areas and to understand if poor sanitation is a cause of outbreaks detected through such surveillance systems, including sanitation promotion within health services. This includes incorporating sanitation messages in community outreach and also direct advice from health workers to patients presenting with sanitation-related disease. Ensuring healthcare facilities have adequate toilets for patients, staff, and carers that are connected to safe sanitation systems for treatment and disposal. Let's now move on to definitions of safely managed. Safely managed sanitation can be defined as per the WHO UNICEF Joint Monitoring Programme for Water Supply, Sanitation, and Hygiene (JMP) definitions, which are simplified for the purpose of monitoring and measuring progress against SDG Target 6.2. The WHO guidelines on sanitation and health provide normative definitions on what safe means at each step of the chain. Those definitions are much more comprehensive and relevant for the purpose of programming. Both the JMP and guidelines definitions are aligned and complementary. Remember, global monitoring is only part of what will be relevant for monitoring locally. Safely managed sanitation is a new rung on the JMP service ladder. To be defined as safely managed, people need to be using an improved sanitation facility that isn't shared, but also which ensures that the excreta collected remain isolated from human exposure. And there are 3 ways that excreta can be safely managed. They can be transported through sewers to a treatment plant. We call that wastewater treated offsite. They can be emptied from containment such as pits and septic tanks and conveyed to a treatment plant. We call that emptied and treated offsite. Or they could simply remain in the ground when a pit is abandoned or empty after extended storage. For example, in a twin pit system and safely disposed or used locally, we call that treated and disposed of in situ. We call that wastewater treated offsite. They can be emptied from containment such as pits and septic tanks and conveyed to a treatment plant. We call that emptied and treated offsite. Or they could simply remain in the ground when a pit is abandoned or empty after extended storage. For example, in a twin pit system and safely disposed or used locally, we call that treated and disposed of in situ. The previous slide showed safely managed sanitation. The goal at the top of the JMP service ladder. Just below that is basic sanitation facilities, which are improved sanitation facilities that are not shared by other households. As part of the monitoring process, household surveys used for data collection ask whether residents have improved or unimproved facilities and what kind. The JMP focuses on data collection for all service levels and the 3 types of safely managed sanitation. However, an important focus is on safely managed on-site sanitation, referred to often by the acronym SMOS, to fill large data gaps and find better ways to collect data on containment, transport, and treatment of fecal sludge. But in the absence of such data, the JMP assumes that 100% of latrines and 50% of septic tanks provide effective containment. Containment also impacts emptied and treated offsite, so can be accessed with an inspection of the on-site storage system asking questions such as, is there an effluent line? What does it connect to? And others as part of a sanitary inspection. An evolving area of evidence collection concerns excreta, the emptied and treated offsite. Data coming from households about emptying is necessary but not sufficient to get emptied and treated offsite. From the households, we can get the proportion of households that report excreta being removed offsite. These are considered potentially safely managed, but only if there are data on transport and offsite treatment. Wastewater treatment is something that many countries have some data on, and the JMP counts secondary or higher treatment for the safely managed sanitation indicator. Primary wastewater treatment doesn't do much to wastewater except remove solid material that will either float or readily settle out by gravity and doesn't count as safely managed unless there is a long ocean outfall that removes the excreta from risk of further human exposure. So, the JMP gets data on sewer connections from the household surveys and censuses but relies on administrative data for information on treatment. And sometimes that data is only available in urban areas or only reflects treatment plan design rather than actual operating conditions. Finally, it's known that some of the wastewater that is flushed into sewers never reaches a treatment plant, either because of leaks or overflows, but it's very hard to get data about this. The next series of slides follow from the toilet all the way through to end use or disposal. They summarize the definitions for safe management in the design, construction, operation, and maintenance of the service, and incremental measures that may be considered if meeting this definition is not achievable in your context. Normative definitions are helpful because they provide more detail to guide program implementation and are aligned with measurable definitions in SDG monitoring. An important thing to note is these definitions are not strict engineering designs. Instead, they are minimum performance criteria to guide existing designs and new innovative design solutions. For more details, you can consult Chapter 3 of the Guidelines on Sanitation and Health. A safe toilet is one where excreta are captured in any type of durable, cleanable, pest-proof seat, slab, pedestal, pan, or urinal that is compatible with local water availability and all cleansing method and the intended containment type. The key principle for safe toilet management is that the design, construction, management, and use is arranged so that users are safely separated from excreta, avoiding both active contact, for example, from soil surfaces, and passive contact, for example, via flies or other vectors. Toilets should be maintained through regular cleaning and replenishment of supplies. Shared, public, emergency, and institutional toilets should have additional features for privacy, safely and hygienic management such as sex separation, locks, lights, menstrual hygiene bins, disability access, and a formal management and maintenance system. The containment step is relevant to non-sewer sanitation systems and solids-free sewer systems where sludge is captured at the household and only liquid effluent enters the sewer. Containers are usually pits, septic tanks, and holding tanks and vaults located below ground. Safe containment stores and in most cases provides some treatment to excreta and wastewater from toilets. Safe designs capture sludge and release liquid to groundwater in permeable pits or in adjacent leach fields or to sewers in the case of solids-free sewer systems. All safe containment is not damaged or doesn't release sludge or liquid effluent to open ground, open or covered drains, or pollute local drinking water sources. Contained sludge must be periodically safely emptied as discussed on the next slide or abandoned when full. Conveyance moves wastewater or fecal sludge from a containment technology to off-site treatment and/or end use or disposal. Conveyance systems can be piped sewer networks or manual or motorized emptying and transport normally via truck and carts. Safe conveyance protects workers and delivers wastewater and sludge to treatment with minimal losses. That means preventing overflow of sewage, dumping, landfilling, and direct agricultural use of sludge. Trucks discharging sludge into sewer lines rather than going all the way to the treatment plant is not ideal because it leads to blocks but is considered an acceptable incremental measure. Treatment refers to the process or processes that changes the physical, chemical, and biological characteristics or composition of fecal sludge or wastewater by a range of technologies so that it is of a quality that is fit for purpose for the intended next use or disposal. For example, wastewater and sludge disposed in high exposure environments such as swimming areas or agricultural fields, growing crops eaten raw will need higher levels of treatment than waste disposed in a low exposure environment such as long ocean outfalls, incineration, or forestry. Treatment should be considering what additional barriers in place at the end use or disposal step and follow a risk assessment and management process, such as SSP discussed in Module 4, to ensure consistent performance and protection of workers. End use or disposal refers to the different technologies and methods by which treated products are ultimately discharged into the environment, either as end-use products or reduced-risk materials. Where there is an end use for treatment products by which, ideally fully treated, wastewater and sludge are ultimately produced, they can be applied or used, for example, as an agricultural fertilizer. Otherwise, additional risk-reducing barriers are needed, or the product should be disposed of in ways that are least harmful to the public and environment. Safe sanitation can be delivered effectively through a mix of approaches and systems tailored to the local context. When matching potential sanitation systems to the context, factors to be considered include physical factors at the household level, like population density and water availability, amongst others shown here. Critically, risks associated with climate change, such as extreme events, sea level rise, and flooding, need to be considered. Also, enabling factors at the household or public level, such as human resources or financial capacity, will impact on the management and sustainability of the system type. We've come to the end of Module 2, the health, rationale, and definitions for safely managed sanitation. We've seen the main WHO recommendations for health protective sanitation and definitions for safely managed sanitation, SMS, to adapt to your context. A few key messages to remember. 1. SMS is needed to achieve health gains from sanitation. 2. Since SMS is mostly outside the control of the household, public and private actors need to play their part to achieve a safe sanitation chain for all. 3. The definitions for safely managed sanitation in the JMP and in the guidelines on sanitation and health are complementary. The SDGs or JMP definitions support targets and global monitoring, while the guidelines support sanitation program implementation with additional details and context, as we saw when looking at the sanitation service chain. And finally, more information is available on all the aspects presented in today's module in the Guidelines for Sanitation and Health, Chapters 1, 2, and 3, and on the JMP website, www.washdata.org.